Gastrointestinal endoscopy involves the passage of a lighted, flexible, fiber optic tube or instrument through a body opening into the lumen of the gastrointestinal tract. This allows direct visualization of abdominal organs and tissues. Common gastrointestinal endoscopic procedures include esophagogastroduodenoscopy, or EGD, colonoscopy, and flexible sigmoidoscopy. Prior to an endoscopic procedure, you will first explain the procedure to the client, including the use of sedation and the required positioning. Next, make sure the client has given informed consent and the appropriate form is signed and witnessed. The client should take nothing by mouth or drink only liquids for a specified time, depending on the procedure. If the endoscopy is performed on an outpatient basis, a responsible adult should accompany the client to and from the facility. Following an endoscopic procedure, instruct the client to avoid driving for at least 12 hours. Following an EGD, the client should not eat or drink until the gag reflex completely returns. Also, advise the client to observe for and immediately report any signs of perforation to the primary care provider. Perforation of the upper gastrointestinal tract is signaled by difficulty swallowing, pain in the epigastric area, back or shoulder, vomiting, and shortness of breath. Perforation of the lower gastrointestinal tract is reflected in abdominal pain, distension, rectal bleeding, and changes in bowel elimination. Finally, there are several radiological tests that can play an important role in the diagnosis of gastrointestinal disorders. Upper GI series or barium swallow. The contrast medium is used to visualize the lower esophagus, stomach, and duodenum. It detects gastric ulcers, esophageal disorders, strictures, and tumors. Small bowel series. The contrast medium is used to visualize the small bowel. It detects small bowel disorders. Lower GI series or barium enema. The contrast medium is used to visualize the large intestine. It detects strictures, polyps, colorectal cancer, diverticulitis, and inflammatory bowel disease. Abdominal ultrasound. Sound waves are used to image intestinal organs and tissues. It detects abdominal tumors and cysts and evaluates ascites. Computed tomography or CT scan. This is an imaging study that visualizes differences in tissue densities. It detects abdominal tumors and masses. Magnetic resonance imaging or MRI. Magnetic energy is used to image blood vessels, soft tissues, and organs. It detects tumors, fistulas, bleeding, abscesses, and metastases. Ultrasonography or ultrasound. High-frequency sound waves are used to image organs and outline structures. It detects cholecystitis, appendicitis, and pyloric stenosis. Gallbladder series. Radiographic visualization is used to visualize the gallbladder. It detects stones in common bile duct, tumors, and obstructions of the gallbladder. Let us now turn our attention to peptic ulcer disease. Peptic ulcer disease involves the erosion of the mucous membrane of the gastrointestinal tract due to contact with hydrochloric acid and pepsin. There are three types of peptic ulcers: gastric ulcers, which usually develop on the lesser curvature of the stomach, duodenal ulcers, which develop in the duodenal mucosa, and stress ulcers, which develop following a major acute medical crisis or trauma. Peptic ulcers can develop at any age, but duodenal ulcers first develop between the ages of 30 and 50, while gastric ulcers are more common in people over age 60. Duodenal ulcers are found more often in men than in women, whereas gastric ulcers are more common in women than in men. The major risk factors for peptic ulcer disease are a Helicobacter pylori infection. This gram-negative bacterium is present in the gastric or duodenal mucosa of 80 to 90% of clients who have peptic ulcers. Cigarette smoking, excessive alcohol ingestion, high levels of stress, chronic use of aspirin, chronic use of NSAIDs, a family history of ulcer disease, aging, high serum gastrin levels, rapid gastric emptying, gastric hyperacidity, and chronic gastritis. What kind of symptoms would we see in clients who have peptic ulcer disease? The key symptom is a dull, gnawing pain or burning felt in or to the left of the epigastric region. The pain develops 1 to 2 hours after eating and is relieved by eating or taking alkali products. Other symptoms of peptic ulcer disease are nausea and vomiting, heartburn, and black tarry stools, which indicate internal bleeding. To assess the client who has symptoms of peptic ulcer disease, you'll first ask about the location, timing, and severity of the pain, and when the pain first started. Next, you'll palpate the client's abdomen for pain, usually located in the upper epigastrium left of midline. If perforation has occurred, the client's abdomen may be rigid and board-like. Esophagogastroduodenoscopy or gastroscopy alone is a key diagnostic procedure for peptic ulcer disease. Esophagogastroduodenoscopy is a technique that allows the examiner to visualize the mucosa of the esophagus, stomach, and duodenum directly with a flexible fiber optic endoscope. This procedure is done to assess gastrointestinal motility and to visualize tumors, ulcers,